Welcome you all to the Curtain Raiser event. I seek the permission of the stalwarts of the critical care present on this platform today to initiate the proceedings. I invite Dr. Narendra Rungta, Chief Organizing Secretary, to share his vision.
Ladies and gentlemen, good afternoon to all of you. On behalf of the organizing committee of World Conference on COVID and Critical Care, I welcome you all to this virtual curtain raising ceremony of the conference. And I also thank you for being with us. Unforeseen morbidity and mortality, stress on our healthcare systems, economic devastation across the world, and scare of more COVID-19 waves still looming large on us really touched and motivated us to think about the proposed conference. The medical scientists across the globe continue to struggle to find the best preventive, controlling, and management measures for COVID-19 disease. It was felt that it is possible if we have international experts from all over the world on one platform and all the possible information be put on one table. We will have brainstorming, discussions, agree or disagree. This will help us in reaching a reasonable conclusion and a way forward to the solution. I am sure this passionate effort of the organizing team will get full support from all over, particularly from the experts from all over the globe and from the industry. I will appeal to the international medical community and to the national medical community to help us to connect to every expert who can contribute. I also appeal to everyone here to motivate maximum registrations in the conference from all parts of the world so that the knowledge and skill that is disseminated during this conference spreads over the whole globe. Objective, dear friends, is only one, and that is to provide confidence to the people all across the globe that the healthcare worker and the community is there all over for the people to protect them and save their lives. I wish you a good luck. Thank you all, and thank you all for being with us. Jai Hind.
Thanks, Dr. Rungta. I will invite the team of doctors to the various launchings of the conference. They are requested to raise their hand and show by clapping that the launching has been done. We announce for the launching of the announcement brochure. I call upon the dignitaries Dr. Praveen Amin, Dr. Ranveer Singh Tyagi, Dr. Rupen Arya, and Dr. Mahel Bahrani.
You want me to start first?
No, sir. You have to just do the clapping.
Okay. I hope that is loud.
We announce, sir, but speaking part will be later, sir. We announce for the launching of the partnership brochure. For this, I call upon our dignitaries, Dr. Jatin Mehta, Dr. Lalit Singh, Dr. Fernando, and Dr. Reena Shah.
Yeah.
You
Can you hear me?
So you can do the clapping that the launching has been done.
All right. Okay.
Speaking part is a bit later, sir. I'll invite you again.
Oh.
We announce for the launching of the conference website. For this, We, for this, we invite Dr. J.V. Divetia, Dr. Rakesh Kumar Tyagi, Dr. John Sukko, and Dr. John Marshall. We announce for the launching of the conference logo. For this, we invite Dr. B.K. Rao, Dr. Deeptimala Agrawal, Dr. Anupam Sharma, and Dr. Kirono. Thanks, sir. We announce for the launching of the registration of the conference. For this, I call upon our respected doctors, Dr. Deepak Govil, Dr. Rajesh Mishra, Dr. Narendra Rungta, and Dr. George Hidalgo. I am pleased to tell with the first push of the button, 250 registrations have already been done. Now we announce for the launching of the update book on COVID and critical care. This I request Dr. Dhruv Chaudhary, Dr. Banambar Ray, Dr. Khusrav Bajan, and Dr. Arindam Kar. We announce for the launch of the social media handle. For this, I call upon Dr. Khalid and Dr. Rajesh Kumar Pandey.
We also have Dr. Charles Sprung here from Israel.
Welcome, sir. May I invite our chairperson and National Advisory Board, Dr. Praveen Amin, to speak a few words.
Hello, my friends. I see a lot of my good friends on the screen. It's nice to see you in this epidemic. For the last 16 months, the world has faced a very challenging time. More so in the scientific community, we have been handling this epidemic, day and night with all sorts of, restrictions that we particularly face. There have been multiple waves in different parts of the world. And in India, we have been particularly hit by a very big second wave, which really had a big impact on patient care. Also, we have certain uncertainties in terms of medical answers. And that's what this conference, we hope, will answer. And I really wish this conference all the best. Good to see you all, my friends.
Thank you, sir. May I invite our chairperson and National Advisory Board member, Dr. B.K. Rao, sir, to speak a few words.
Good evening. It's a very joyous moment for me to see all the faces. Some I have not met for a long time now. Like Praveen said, he's there. I have few points for this conference. One, that over the time since it started somewhere in December 19, we have learned something. We have the knowledge, we have the experience, but trust me, what we know is fraction of what is there in the field, in the world or out there. And the second thing which is troubling is that we are in different timelines. So some people know the latest, and some people are still practicing what was valid 2 months ago. And this is not only true within the hospital, it is true in the geographical area. So the people who work in the metropolis compared to those who work in the rural or in the semi-rural, semi-urban backgrounds. So I think this conference is going to set the timeline that everybody comes on board at one point of time, and everybody then from there on practices at least what we know about this virus and this disease. And there should be many more like this more frequently in future so that everybody stays on board and not that we have different practices in different parts of the world. Thank you, and my good wishes for this conference success, and all the best. Thank you.
Thank you, sir. With this, I invite our chairperson and National Advisory Board member, Dr. Yatin Mehta, to speak few words.
Thank you. It is indeed a pleasure to be here with all of you. And over the last 1.5 years, we have had several CMEs, but not a consolidated multi-speciality international meeting like this dedicated to COVID. We have learned a lot and unlearned a lot over the last 1.5 years. Many therapies came, many drugs came and went out of the window, and many new drugs have come and coming. Vaccines have come, gone and coming. So a lot to learn and lot more to learn. So I think we should be ready by our infrastructure, by our knowledge, and by our expertise for the third wave, which is bound to come. And I think better to learn from other people's knowledge or mistakes or whatever you call it, to be able to face the challenges which we are going to have very soon. So all the best. Dr. Rungta has put in and team have put in a lot of effort, and I expect it to be a very productive conference. Thank you.
Thank you, sir. With this, I call upon Dr. J.V. Divitya, our chairperson and National Advisory Board member.
Good evening. It's nice to be amongst friends, even though it's virtual. Zoom has brought about, has at least allowed us to come together from this distance. It has narrowed the distance. And, in this last 1.5 years, we have learned a lot, but I guess there's still a lot to learn, and we really haven't learned much anyway. So we have to learn more about the disease, and we can learn about the experiences from experts all over the world and take forward the best SOPs and protocols and the best of what others have learned and what they can teach us. So brainstorming, exchanging views and ideas is the mantra for the future. And with this background, we have embarked upon this program to organize this current event. And here we will have the best brains, the researchers, the doctors, the scientists, the philosophers on one virtual platform, the World Conference on COVID and Critical Care. Okay, so I'm really looking forward to this event, and I'm really looking forward to join all of you. And I wish this conference all the very best. Thank you.
Thank you, sir. With this, I call upon our International Advisory Board Dr. Rupen Arya from UK to say a few words.
Thank you. It's really truly a pleasure to be part of this very important initiative, the World Conference on COVID and Critical Care. And I'm delighted to be sharing the stage with many of my dear friends with whom I've done many CME events in the course of the past year on COVID and thrombosis. These truly are extraordinary times. We are inundated by information and misinformation. There's been a huge acceleration of research with over 3,000 RCTs. Daily, 400 scientific papers related to COVID are published, of which only a handful are relevant to our clinical practice. So I think that there's a big challenge to stick to the evidence base. As a thrombosis doctor, I've been kept very busy with this phenomenon of immunothrombosis.
Dr. Govil ko bulana hai.
But it's only one part of the jigsaw of improving the care of COVID patients. So again, to reiterate, it's a pleasure to see all of you. And I look forward to joining you all for the World Conference on COVID and Critical Care later this year. Thank you.
Thank you, sir. With this, may I request Dr. Curono from Italy, our International Advisory Board member, to say a few words.
Hello, good evening to everyone. I would like to thank, first of all, Dr. Rungta for this kind invitation. And I am very happy to be in this board because I can find again many old friends. My opinion, I am very eager to listen to all these important speaker topic, and I hope that we can clarify some points. My opinion, I wrote many editorial with important journal that we have made a lot of mistake, and still now there is not a common learning from this lesson. So I hope that we can understand where we go forward to go out from this pandemic. Thank you again. Ecco, arrivo, stavo in conferenza, sì.
Thank you, sir. With this, I call upon our National President of ISCCM and our National Advisory Board, Dr. Deepak Govil, sir, to say a few words.
Thank you very much, Dr. Deeptimala, for inviting me. First of all, I would like to thank and congratulate Dr. Rungta and his entire team for organizing such a fabulous conference where we can see a galaxy of stalwarts sitting at the one platform and disseminating their experiences and sharing their knowledge with all of us. I invite all of you to register for this conference, and I'm sure this will be a very good academic feast. And the organizing committee has extended the 50% discount till 31st of July as early bird registration. So I request all of you to kindly join this conference and gain the knowledge and experience from the international experts and national experts. Thank you very much.
Thank you, sir. With this, I call our International Advisory Board Doctor, Dr. Mahar Al-Bahrani from Oman.
Thank you so much. There's a big greeting from Oman. My great pleasure to be with you all. And my big thanks to Dr. Rungta and the organizing team for inviting me to be with you. As every friend and colleague mentioned, of course, in the last 18 months, we could not get together because of this pandemic, but this is a one of its kind in the world to come together and discuss this very puzzling disease that we have seen. We have learned, but we are still learning. Every day we see new things coming up from this pandemic. And this is something that we need to get together and get all experiences and to share the knowledge between all ourselves in the battle against this pandemic. Again, thank you so much and looking forward to be with you in October. And I encourage everyone in the fraternity of critical care in the world to join us here. Thank you and best regards to everyone and good luck.
Thank you so much, sir. With this, I invite Dr. Dhruv Chaudhary, our Chairman, Advisory Board of the conference.
Thank you, Dr. Thank you, Dr. Deeptimala. I think I must compliment Dr. Rungta, our ex-president also, for being innovative, thoughtful, and insightful, because the second wave has been really left India devastated, and throughout the world we are seeing now the Delta variant. I think it will give us a lot of chance to discuss and organize things, and I am certain
that we will be putting a lot of emphasis on the basic sciences, which are the pillars of the clinical sciences. So with these remarks, I wish all the best, and I'm certain we are going to have a good time discussing all the aspects of COVID, not only simply related to critical care. That's only one end of the spectrum. Thank you very much.
Thank you, sir. With this, I take the opportunity to call upon Dr. Rajesh Mishra, our President-elect of the ISCCM, to speak a few words.
Thank you, Dipti, and thank you the entire team for this opportunity. And I'm very sure that this event is going to be one of its kind, because all the experts, all the stalwarts are on same panel. And this disease which has hit us is not something which we have learned, and we are learning, and we are still in our learning curve. So in coming 2 or 3 months, probably it may be possible that India may get affected with third wave, and we will have some more data about the third wave. So when this conference will go in reality on virtual platform, we'll have lot to share. We will encourage, we will ask all our students and colleagues to register for this conference, so all of us can learn from this big platform, because we have not seen in last 18 months such a big platform, so many stalwarts coming on platform and sharing their knowledge. So with this, all the best, Dipti, and all the best for the successful conference. Thank you.
Thanks, Dr. Rajesh. With this, I invite our international speaker, Dr. Charles Sprung, to say a few words.
Unmute, sir, please. Please unmute first.
Dr. Charles, please unmute yourself. Down there on the left-hand side, you can see unmute button. Down on the left side of the machine. I think he's connected. He's just connecting. Hello, maybe he's low with internet. Till the time he's connecting, Dr. Deeptimala, can we move to the next speaker?
May I request Dr. Banamar Ray, sir, to give some blessings to our conference. Dr. Ray.
Yes. Thank you, Dipti. This is an excellent opportunity for all of us. Dr. Rungta has actually shown the way to show to the world that I think yet again we have taken the lead here. We have taken the lead because we have actually been devastated in the second wave. I think this is quite befitting that we also take the lead to group everybody in the earth to actually talk about COVID. And I'm sure, I think after 3 months, we may come out with certain very plausible kind of way forward to tackle this third wave. At least it would be actually devastating us, hopefully, or anticipating that it will devastate us during that time. So therefore, I would like to congratulate Dr. Rungta and the Agra branch. Agra branch actually has taken the lead. Dipti and colleagues, I'm sure, I think you will be at the end of this conference doing a tremendous job for the whole world. So therefore, congratulations again to Agra branch. And with all this, I would request all the people who are concerned, in fact, it is not only confined to the critical care group, it is confined to, in fact, whole medical fraternity and also the public. So all of us will be grouped together in this particular conference, and I'm sure this will be a conference of one of its kind in the earth, and it would be showing that way that we are all together in the time of disaster. Thank you very much for giving me this opportunity, and wish you all the best for the success of this conference.
Thank you so much, sir. With this, I call upon our international faculty and advisor, Dr. Michael O'Leary. Dr. Michael.
Hello, good afternoon. As with everyone else, I'd like to thank Narendra Rungta for the invitation to participate in this really important initiative. Here in Australia, we have been fairly protected from COVID, apart from in the state of Victoria, where even there was only a modest outbreak in the middle of last year. But I think what we're learning here in Sydney in the last few weeks is that it's impossible to avoid the impact of this disease locally. And of course, our achievement in avoiding it has been at the expense of closing the country off to the entire world for all of the last 15 months. And the future, I think, even with vaccination, is that we are going to face problems from this disease for many, many years to come. And the only way that we're going to fight it is by collaboration internationally. So I think this is a really important initiative, and I'm delighted to have an opportunity to participate in it. And I hope that I will learn much more from it. I'm sure I will learn more from it than I can give, and that's a great opportunity for me to bring here to Australia. So thank you, Narendra, and thank you to all who've been involved in setting up this conference. Thank you very much.
Thank you so much, sir. Now I'll invite Dr. George Hidalgo from Belize to say a few words.
Well, first of all, I would like to thank you, Dr. Narendra, and the whole team for the invitation for me to be part of a great initiative. I think so. Everybody is already saying it's a great opportunity for us to learn more than to give. And we are really delighted and honored. And I'm sure this conference is going to be a complete success. Thank you for the invitation.
Thank you so much. I'll call upon Dr. Saud Anwar from US to say a few words.
Thank you so much, Dr. Agarwal, and thank you, Dr. Narendra Rungta, for your leadership and all the organizers. This is incredible that we are all going to have a very important conversation. Look, this disease has changed the world. This disease has changed the lives of thousands of people. Each and every one of us are aware of how it has personally impacted us, but also individuals, patients, families that we have interacted with. This is an era which would require us to hold all our hands together and come up with solutions so that we are better prepared. No disaster should ever happen without us learning to be better organized to manage this. The intersection of this disease includes critical care, becoming primary physicians for that matter, also with policymakers, public health, and resiliency within communities. So requires all hands on deck strategy, but at least from a medical perspective, this is going to be one opportunity to have frank conversations about how we could have done things better and how do we do with respect to the future planning going forward. So I'm looking forward to learning from each and every one of you, and I want to thank the organizers for their leadership and planning. Thank you.
Thank you so much. Now, may I invite Dr. Khushrav Bhajan to say a few words for the conference.
Thank you, Dipti. I once again compliment Dr. Rungta for bringing the entire world on one platform to fight the menace of COVID pandemic. The coronavirus or the COVID virus has been extremely smart, and it has evolved from the alpha strain to the beta to the gamma to even the lambda from Peru, and the pluses and the minuses that are there. And every country in its own way has fought this menace. And it's a great initiative by Dr. Rungta and team and the ISCCM that we have been put forward. We've put our best foot forward and got the entire world at its platform on one occasion of this conference. So it will be an amazing thing to share our experiences, learn from every country how they have dealt with this menace. And as Darwin always said, survival of the fittest. We know that the corona is an extremely dangerous bug, but nobody can be more fitter than the intensivists all over the world. And I'm sure we will conquer and we will win over this menace. Thank you so much.
Thank you, sir. May I invite Dr. Jean Sukko to deliver a few words?
Unmute, sir.
Oh, hello, everyone. Greetings from Seoul, Korea. I would like to echo the previous speakers' appreciation and congratulations to host this meaningful World Conference. I also wish this conference is successful, sharing our experience taken during combat with this COVID-19. Thank you for inviting me. Thank you.
Thank you so much, Doctor. Now I'd like to invite Dr. Lilanti from our neighboring country, Sri Lanka. Dr. Lilanti.
Thank you, panel. Thank you, Dr. Rungta, for inviting me to this extravagant event. Echoing the other speakers, I would like to say this is a great opportunity for us as South Asians to involve with the other countries in the middle of second or the third or the incoming fourth wave for us. So it's a great pleasure to be in this platform and would like to share my experience and acquire knowledge and experience from you all from every corner of the world. So I wish great success to this wonderful program ahead and waiting for that along with our trainees and all of the intensivists from Sri Lanka. Greetings to you all from Sri Lanka. Thank you.
Thanks, Dr. Lilanti. With this of our curtain raiser event, keeping to the time, we come towards the end of the event. And for the Thanksgiving, I will call Dr. Ranbir Tyagi, the organizing secretary of this conference.
Namaste. Good evening to all respected seniors and dear colleagues. Thank you very much to giving time, your precious time for this event, curtain raisers, in spite of their busy schedules. And I thanks to all people who are joining this event and people of pharma company also. And I request all of you to send this flyer and conference brochure to all your colleagues and your friends and your students. And I also invite you for the next year physical conference in Agra 2020. Thank you very much. Thank you once again.
Thank you so much to all the national and international faculty and doctors for taking out time for this evening today. Looking forward to seeing you all in near future, virtually this year and in person next year. Thank you.
Thank you.
Thank you all.
Good show, Naren.
Thank you, Praveen.
Thank you so much.
Thank you, Maher.
Thank you.